Hi, we're really glad you turned into the third clip. Now, what we're going to do here is talk about some tools to help you get started. Breathing. We'll go through why we're really concentrating on breathing. Finding your loving kindness phrases. That takes a bit of work. Mindfulness. Let's introduce what that is. But we also want to talk about when self-compassion is hard to do. So let's start with breathing. When we get anxious, our breathing becomes rapid and shallow, breathing from our chest. You can turn that around and breathe more from the pit of your stomach and breathe out more than you breathe in. That can turn on the calming part of our nervous system. Now, there's different types of breathing. Here, we're just going to encourage you to sit or lie comfortably. Close your eyes if you can. Try to breathe through your nose rather than your mouth. Breathe deliberate from your belly, not your chest. And deliberately slow your breath down. Count to 4, pause for a moment, and then breathe out for 4 or 5. Make sure your breaths are smooth, steady, and continuous. And you're paying particular attention to your out breath. Your out breath, that's what's going to help you relax. Now, let's just try this. A little technique I like to do when I'm trying to do relaxed breathing, particularly when I'm anxious, is when I'm breathing in, I'll count for 2. When I'm breathing out, I'll pucker my lips like I'm blowing out a straw. We call it puckered breathing. Deep breathing is one of the most powerful tools we always have with us to help us deal with some of those difficult things. It could be an important part of getting started with self-compassion. Now, the second thing, this can take a little bit of work, is finding loving kindness phrases that are going to work for you. Now, that can be tricky because they've got to be personal, tailored for you, simple, clear, and they're going to be real. A common statement you believe, and the tone you say it is as important as the words. Now, the number of times you say a phrase matters less than the attitude that we have during the practice. Now, they've got to be real. They've got to be meaningful for you. They've got to be something you believe. So it could be, may I be happy, may I live with ease, may I live with fear. They could be wishes for yourself. They could be hopes, but they need to be realistic and finding phrases that do work for you. Now, this might be a little technique just to find what phrase will work with you. Put your hand on your heart and breathe and feel your body breathe. And ask yourself, what do I truly need? If this need isn't fulfilled in any given day, if your day doesn't feel complete, let it be universal. The need to feel connected, loved, peaceful, free. And what do I need to hear from others? What words would I like to hear every day, whispered in my ear for the rest of my life? What words will make me say, thank you, I needed that? Allow yourself to be open to that possibility. Now, if you can think of some phrases used, write them down. Settle on 2 to 3 that you can use. And these words are gifts you can give yourself over and over and over again. Now, the third part of self-compassion is mindfulness. Now, that takes a bit of practice to get used to too. Now, mindfulness is when we focus all our attention on one thing. Now, when we practice self-compassion, we use it to focus in on those emotions, to bring ourselves back to the present, non-judgmentally, to own them. So maybe just to begin to practice mindfulness, use relaxed belly breathing. Focus all your attention on one thing, a sound, a sight, a smell. You're doing this non-judgmentally. Don't judge it as good or bad, just experience it. You're bringing yourself to the present moment by focusing on one thing. And it might help just to open your mind to the beginner's mind. You want to try new things like mindfulness. This could take a bit of practice to get used to. And when we're using mindfulness, mindfulness in the terms of self-compassion, well, this might help. Now, we don't have this in the booklet, but people said this was really helpful when we did that workshop. It's using RAIN. RAIN is an acronym of how we can help deal with those thorny feelings when they come up using mindfulness. Now, the R stands for recognize the feeling. Don't try to push it away or ignore it. Just notice it. Put a name on it. Acknowledge it. The second step of this is just accept the feeling. Allow it to be there. Give yourself permission to feel it. This is the entry into self-compassion. The I for your RAIN stands for then you might want to investigate. You're curious with a sense of openness and curiosity. An important thing about feelings, the N stands for non-identity. We consciously avoid being defined by a particular feeling. A feeling is temporary. So we're using the words I feel rather than I am, or more than just a feeling. A feeling is a state. I am is more talking about a trait. So that can help us make use of mindfulness when we're practicing self-compassion. Now, self-compassion can be a bit hard to do, particularly if it's the first time you've tried to use it. We got to be careful of backdraft. Well, what is backdraft? Backdraft is a firefighting term. You think about this, when you start a fire of oxygen, fire doesn't go out, but it dies down. You feed oxygen, into the fire, it ignites. So if we've opened our door with self-compassion, well, there could be some pain that we let out. We experience that pain. We try to use self-compassionate phrases, but we're so used to knocking ourselves, we get that backdraft and those negative emotions fly up. Now, firefighters, when they're dealing with backdraft, what they do, they poke a hole in the door, they might break a window, they'll let the oxygen in slowly. The same with self-compassion exercise. So if you do notice, this not working for you right away, or that criticism flares up, label it. This is backdraft. Name the emotion. This hurts. This is pain. This is grief. This is exploring the body where you might feel it, where it resides, and offer a soothing touch to it. Redirect your attention to neutral focus in the body, the breath, the soles of the feet, and some of these exercises can help you do that. If you find backdraft kicking in and difficult to do, sometimes more behavioral things and some of the things like feet on the floor that we're going to do later on might help, but also bring mindfulness to daily activities. A warm bath, petting a dog, walking, bringing yourself back to the here and now. Now, this isn't about being perfect. It's practice with repetition. And practice, as we said earlier on, is key to building any new habits, including the way we talk to yourself. So when you bring that effort every day, that's what's going to make this work for you. Now, what we're going to do in the rest of these clips, we're going to have an individual clip for each of those 8 exercises. These are all in the booklet. You can read them, but some people were telling us we would prefer listening to it. We're all different types of learners. Some people, with their visual, they want to see it and okay reading it. Other people would rather listen to it. So that's why we've made this series of clips. Let's put each of those 8 exercises on a clip that you can watch, listen, and do along so you get used to doing it. Now, what we also have in the workbook is a sheet to help you monitor your progress. Because when you write that down, and use HEAL, not just have the positive experience, but enrich it by writing it down. You're enriching it, absorb it, and link it to the benefits you see. And by writing it down, we believe this can really help you own the progress you're making. So what we'll do one by one is have a series of clips where we'll put those exercises that are in the booklet there for you to try. Now, there's more exercises on self-compassion. We chose 8 that we believe can help us get started, but we'll also finish by in the booklet sharing with you where you can get more information on self-compassion if you want to dive deeper. We hope this is helpful. And if you want to, keep going and try those exercises and find the ones you like that really you benefit from. We wish you well with this.